Orthoptics, a small profession in great demand. Each year, people of all ages, particularly children, visit a clinic or medical office such as this. Their physician or optometrist has made a referral to an ophthalmologist or eye specialist due to the possibility of a visual disorder. The individual on the front line of the team is the orthoptist, and an orthoptist specializes in diagnostic evaluation and treatment of people with eye movement problems and defects in depth perception. Orthoptics has been affiliated with ophthalmology for over 50 years, and it is a profession increasingly in demand.
Peyton. Hi, my name is Mara. I'm the orthoptist at the eye center.
Hi,
nice to meet you.
Come on this way.
So tell me, what brings you into the eye center today?
I've been noticing Peyton's eye turning in, her left eye. Probably over the last 6 months I've been looking back at some pictures of her.
Proper vision and depth perception involves the use of both eyes, or binocular vision. When the eyes do not function or focus in alignment with one another, the result can be impaired vision or double vision. Although this can happen at any age, two of the most common disorders, strabismus and amblyopia, are found in young children. 2 to 5% of all children suffer from strabismus, a misalignment of the eyes. When strabismus persists without correction, amblyopia, often called lazy eye, can occur. Some adults with certain medical conditions, such as diabetes or high blood pressure, may often experience double vision. The orthoptist carries out a series of diagnostic tests and measurements to assess visual function and how well the eyes work together.
Thank you very much. You did great. If you want to take Mom back to the waiting room, and the doctor will call you in very shortly, all right?
Upon completion of the initial examination, the orthoptist records results in the patient's medical record. An orthoptist is specifically trained to evaluate visual function and interpret test results. They can offer a diagnosis and will work with the ophthalmologist in formulating individual treatment plans.
And how do you suggest that we proceed today?
Well, I think that she needs to have a cycloplegic refraction done to determine whether she's got a refractive error.
Mm-hmm. Okay.
All right?
Well, let's do that then today.
Excellent.
Like ophthalmology, the field of orthoptics is constantly evolving, and traditionally when orthoptics began, it was probably more related to pediatric ophthalmology and dealing with diseases of children. Now it's orthoptists are employed by all sorts of ophthalmologists, general ophthalmologists, neuro-ophthalmologists, as well as pediatric ophthalmologists. Orthoptists are involved in assessment of patients who are having laser refractive surgery, as well as cataract surgery, and just in the general assessment of all patients. I think the orthoptist is very involved as a patient advocate. First of all, I think in the case of children especially, it may be easier for the orthoptist to speak to the child or to examine the child because they may find them less intimidating and they may have more time to spend with them. They're involved in reinforcing everything that is discussed with the physician in terms of what their disease is and what the appropriate treatment is. They explain different alternatives in management, and they develop a relationship with the patients. In addition to being a strong patient advocate, they would increase the efficiency and productivity of the office. The ophthalmologist and the orthoptist have a very close working relationship. They have to communicate very effectively together to make decisions about patient management, and they come to these decisions as a team.
Well, Mom, our findings today do show that Peyton's left eye is turning in much of the time, and because of that, she doesn't see as well with the left eye as she does with the right. In addition, she needs to wear glasses.
North America has a large demand for orthoptists. I think we currently have more positions available than we do have graduating orthoptic students.
Jackie, I've gathered some information for you about strabismus and amblyopia.
The role of patient advocate is probably one of the most critical functions of an orthoptist. Even the most healthy and active children may be dealing with teasing from their peers and lack of self-esteem due to even a slight physical anomaly. Sensitivity and patience go hand in hand with clinical evaluation in order to help patients and families understand diagnosis, prognosis, and the importance of treatment practices. In some instances, surgery may be an option for the patient. Some orthoptists are trained to assist with surgical procedures if required. In fact, upon receiving certification, an orthoptist is presented with a wide variety of opportunity within their profession. Workplace settings include hospitals, solo or multi-specialty group practices, or travel to smaller centers in a consulting role. Some orthoptists direct regional and local vision screening programs. For those who are employed in teaching hospitals, orthoptists become instructors. For the academically inclined, orthoptists are encouraged to participate in clinical research and the presentation and publication of scientific papers. In fact, continuing education is essential to maintaining certification. A career in orthoptics also entails membership in professional organizations in the United States and Canada that promote the professional and educational competence of their members.
I was waiting to find something postgraduate once I'd finished my degree, and I was not having very much luck finding anything that really interested me. And then when I came across the orthoptics program in an advertisement in the career section of the newspaper, it really caught my attention and sounded like something that I would be really interested in pursuing. I was interested in the fact that it was within the healthcare profession. It had to do with a lot of work with children. I wanted to do something that was scientifically oriented that would allow me to do some research in the future, and I think that it appealed to all of those aspects. It could be something that would be appealing to a wide variety of people. You have to be patient. I think somebody that's got a willingness to try something new and to be in a really exciting and dynamic environment that allows you to study a lot of different and really interesting things. I would estimate that I've seen over 1,000 patients in clinic so far. I think it's really enhanced what we've learned in the classroom. That allows us to draw parallels between what we actually see in clinic and what we see in the patients that we are interacting with on a daily basis. The job market is unbelievable right now. There's so many opportunities for us. You can pick and choose wherever you want to go, and there's just a phenomenal amount of opportunity right now. It's just a huge, huge career right now that you can go anywhere in the world with it, really.
To become an orthoptist, you require a degree. Successful applicants have a background in the sciences, mathematics, and child development. Orthoptic programs are 24 months in duration and are usually affiliated with medical schools and universities. In addition to course study, orthoptic students also apply theory by clinical experience. Program progress is assessed on a regular basis by the supervising orthoptist. At the end of 24 months, the student must complete a written, oral, and practical national board exam to become a certified orthoptist. Upon entering the profession, candidates can anticipate placement throughout North America at competitive salaries.
Your vision has improved so much since you first came here 6 months ago. Your eye doesn't turn in as much as it used to, and you're seeing a lot better than you were.
I noticed that she's not leaning in to visualize, especially watching television.
So I'm glad that you work so hard. We've been doing really well together, and you're going to come back and see me later on.
Thank you.
You're welcome.
If you are looking for a career in healthcare, have an aptitude for scientific work and teaching, and are committed to contributing to the welfare of others, orthoptics may be your field of choice. As technology evolves, so does the role of the orthoptist. The comprehensive training and emphasis on continuing education ensures that the profession grows apace with new developments. The versatility of the profession is evident in the broad variety of job opportunities and responsibilities available. Now and for the foreseeable future, many placements exist throughout North America for individuals who choose to pursue this exciting and rewarding career path. For additional information or to locate an orthoptic program near you, visit the following websites: